Welcome, everyone, and thank you for joining us tonight. We'll get started shortly. We'll just give it a few more moments. Okay. Well, good evening and welcome to Understanding Weight Bias and Its Impact. My name is Karen Bertozzi. I'm part of the programs team with Mended Hearts. You may know that this is Obesity Awareness Week, so thank you for spending part of your evening with us tonight. Before we get started, we have a couple of housekeeping things to bring to your attention. So all the attendees are in listen only mode. We will not be able to answer any specific questions related to your condition. Please be sure to type your questions in the Q&A box so we can answer them at the end of the webinar. And this webinar is being recorded and will be available on our website at www.mendedhearts.org and also on our YouTube channel. And before we get started, I want to be sure to thank our sponsor. We are grateful to Novo Nordisk for their support in making this webinar possible. I'd like to welcome our speaker tonight. Our speaker is Joe Nadglowski. He is president and CEO of the Obesity Action Coalition, the OAC. It's a nonprofit organization formed in 2005 dedicated to elevating and empowering individuals affected by obesity through education, advocacy, and support. Joe's a frequent speaker and author. He is especially passionate about access to obesity treatments, tackling weight bias, and sharing his own experiences with obesity. He has more than 30 years of experience working in patient advocacy, public policy, and education, and he's a graduate of the University of Florida. Go Gators. Joe, I'll pass it off to you.
Thanks, Karen. I appreciate that. And I'm going to flip over, Karen. If you will do, I will share my own slides. Thank you there. And we will switch to that. And let's begin. So as Karen mentioned, I'm going to talk to you about an important topic tonight, and that is weight bias and stigma. And how I often like to start these talks is to just be frank about the conversation, right? We are going to talk about a challenging topic tonight. And I want you to know that I really believe in my heart that most bias and stigma is unintentional, right? People just don't understand that they are doing harm. But I also know this talk can be painful for some folks because oftentimes you might see yourself in ways, and I'll share my own experiences with bias as part of this. And really why I do this is not to help have people relive any pain they might have, right, kind of thing. I do it because I think through education is the only way we're actually going to be able to solve this issue. Blame and shame is one of the hardest parts of living with obesity, and we have to talk about it. The other thing I will say is if you see yourself in any of this, meaning that you're someone who might have engaged in bias and stigma, I'm going to give you some tools that I think that maybe you can think about it differently and then hopefully try to make sure that you don't engage in those behaviors in the future. When we have these discussions, I like to start off saying, if we were here today talking about cancer, we'd agree that cancer is bad, but we have compassion and empathy for people with cancer. But somehow in our rush to make obesity bad, we've made the people with obesity bad. And honestly, that is the fundamental issue we're going to talk about tonight. We have to challenge that, right, kind of thing, because people themselves are not bad, right? It is their health condition that is the problem, not the individual themselves. And until we do that, I really think, until we create that understanding, we're really going to continue to struggle to address with these issues around obesity. So here are my disclosures. I have no personal relationships with the industry. I am an employee of the Obesity Action Coalition. Of course, OAC works with lots of different companies and most of the evidence-based obesity care industry. Probably easier to say who we don't take money from. We don't take money from food companies, and we don't take money from non-evidence-based obesity treatments, so compounders, et cetera. And maybe the most important disclosure is I am a person living with obesity. I'll share my own experience as we go through these slides. But you currently see me probably at the my healthiest that I've ever been in my now 34 years of struggling with obesity. In my family, we began struggling around our 20th birthday. So I just turned 54. So I've struggled with obesity for 34 years. And I like to remind folks that I've been in a dozen behavioral programs in my life. I'm on my seventh medicine now to treat my obesity. So treating my obesity being has been complex, and of course, it adds to, in effect, what is my bias around bias and stigma, because I know personally how much bias and stigma really can affect someone's life. So this is how we'll talk about bias today. We'll really define it. We'll recognize where it's happening. We'll understand the real world impact. And then I'll talk to you about some actions you can take to reduce harm. I will say that you're going to see a lot of these slides are pretty technical. I'm not going to spend a lot of time reading definitions to you and things like that. I'll offer you my perspective on kind of on how I view these issues and hit the main points. But there is a lot of data in today's presentation. And of course, these slides and the recording will be available to you afterwards. And actually, at the end of my deck is actually a reference list of all the references. And bias and stigma is actually remarkably well studied. We've had thousands of studies that actually review and look at how bias and stigma, how blame and shame really hurts people in their efforts to address obesity. So what is bias? Here are the formal definitions, but I will just tell you it's simply negative attitudes towards people because of their body size. And I will say that it can come in lots of different forms. It can be implicit, which is kind of what you think when you see somebody, or it could be explicit, what you say when you see someone because of their body size or body weight. And it can turn into much worse things, which is stigma, prejudice, and outright discrimination. And in fact, I like to remind folks around this when it comes to weight bias and stigma. It is perfectly legal in the United States to actually discriminate against someone because of their body size. There's two states that are exceptions. One is the state of Michigan by law, and one is the state of Washington by court order. But for example, your employer could fire you today because of your body size and you would not be protected. You could be denied renting an apartment and you would not be protected. And that really is the discrimination that I'm talking about. And bias can come in many, many different forms. It can be verbal, it can be physical, it can be cyber, it can be real, it can be perceived. I say that because if you have someone like me, for example, who has been stigmatized many times in my life, I actually, especially in the healthcare environment, I really perceive that every healthcare professional is going to mistreat me about my body weight. And in fact, I broke in a new primary care professional just over a year ago now. And I was actually surprised because for the first time in my adult life, I didn't think I was being stigmatized by my doctor because of my body weight. But what my doctor had to work really hard, right, to overcome that, this fear that I had that she was going to stigmatize me because of my body size, even though at that point I was relatively well treated for my obesity. And she took over that care and has done a remarkable job for me. And then, of course, bias can be really subtle. It can be really overt. And I'll show you examples of that later on. And there's all kinds of biases. I mentioned already, you have this explicit bias that's getting made fun of on the street. You have this implicit bias, which is what people are thinking. And maybe the most important form of bias that is on the slide that I don't think people understand enough about is this internalized bias. And what I mean by internalized bias is when you actually start to believe what other people say to you about your body and your body size. And I can tell you quite clearly, this has impacted me very directly. No one has ever said anything worse to me about my body weight than I've said to myself, right? Kind of thing, looking in the mirror. And that's because of internalized bias, and actually overcoming internalized bias, even now at a reduced body size and a much healthier weight. I still struggle with this, and many people still do, dealing with those issues. In fact, many people have to seek mental health care to be able to overcome that internalized bias when you start to believe those things that society has lumped on top of us. And really understanding bias is important because it keeps people with obesity from seeking help, and it keeps healthcare professionals from offering it. It really harms people directly. And I'll go more about this into my slides, but many people with obesity will actually tell you it is the social stigma around obesity that is the greatest impact on their lives, more than even the health impacts. That's not in everyone's case, but in many cases, you hear that from folks, especially people who are of a younger age. It definitely impacts our policy work, the work that I do on a daily basis to try to improve access to obesity care, to change the world, how the world thinks about obesity. This week is Obesity Care Week, and we're trying to change the way people care about obesity. And honestly, bias runs rampant in that space as we're trying to get policymakers and other key decision makers to do more to change the system, because I really believe that obesity is a system problem, not a personal problem, to get them to change the system. But bias runs rampant, preventing that from happening. And it is one of, as I mentioned earlier about discrimination, is one of the last socially acceptable forms of discrimination. Now, here are those examples that I mentioned to you before about, let's talk about really specific ways that bias exists in the world right now. And so I'm going to cite two examples off this slide, but on the left-hand side is actually a billboard that was in Jacksonville, Florida, now a little over a decade ago, um, put out by the folks at the People for the Ethical Treatment of Animals, PETA, where they said, "Save the whales, lose the blubber, go vegetarian." Now, the only thing this billboard did in Jacksonville, Florida, is teach children to refer to women with larger bodies as whales, right? Kind of thing. I don't think any person was going to become a vegetarian because of a billboard along these lines. And it was an interesting story as we engaged around this issue. And again, we have weird situations when it comes to bias, and in this situation, I actually got to debate the CEO at the time of PETA. Her name was Ingrid Newkirk. Miss Newkirk is either a hero or a terrorist, depending on your political views, right? I got to debate her on all things the Montel Williams show. So hopefully some of you remember Montel Williams and the shows he used to do. And we actually had a debate about this billboard. And at the end of the show, Miss Newkirk agreed to take the billboard down. And then Montel Williams went on this like 5 minute long soliloquy about how two people with differing views can hash out their differences in public, and then ultimately a decision that benefits all that was made. Unfortunately, I guess Miss Newkirk didn't like that. I don't have a picture of it, but the billboard was gone the next day. It was painted over black, but on it in big white letters were the words, "The billboard's gone, and so would be your blubber if you'd gone vegetarian." And that's a real case scenario. And again, many people still believe that we're going to shock people into addressing their obesity. I actually happen to believe a vegetarian lifestyle would benefit many people with obesity, but this is not the way you're going to do it. No one became a vegetarian because of this billboard. I'll flip to the other side of the screen here just because this one bothers me probably the most of all of them. That app, Fatify, is a real app that exists on the App Store today. Your children down to the age of 4 can download that app. It's approved for ages 4 above, where people can make themselves or their friends or someone else look like they're heavy and post it on social media. That's a real app. And the reality is we don't need to be engaging in those kind of behaviors. Those are doing more harm than good. And I can't see any potential positive benefit of such an app. And then we see bias in language. And here's some language that you might hear about obesity all the time. And I will tell you, every bit of language in these green boxes on the screen is inaccurate. So obesity is caused by a lack of willpower and self-control. People who can't manage their weight or obesity are just lazy. Regain or worsening obesity is a sign of personal failure. Stigma is needed to motivate people to be healthy, and people with obesity are unhappy and have emotional problems. All of these statements are untrue. Obesity is a complicated disease. People try awfully hard to address their obesity. And I've yet to meet someone who struggles with their weight who hasn't tried over and over and over again to try to do this. And actually, Kevin Hall, when he was at the NIH, did some amazing research that actually showed that people were trying unbelievably hard. It was just that their biology was actually pushing back and making it so that they didn't find the success that they were seeking when it came to their body size. And I will say that, not everyone with obesity is unhappy, right? Kind of thing. People like to say there are people suffering with obesity. And I would just challenge you is that not all of us with obesity are suffering at that moment. In fact, you can't look at someone and say whether or not they have obesity. Obesity is not about body size. Obesity is having too much body fat that harms your health. And so there are people that live in larger bodies that have no health consequences. They may not be unhappy or they may not have emotional problems. Maybe they do. But the reality is it's not everyone. So we can't make those kind of assumptions. That's one of the things I'll tell you later on in this presentation and give you a challenge to yourself is not to make an assumption about anyone based on their body size. So we have to address this. Why am I talking about it today? Why have this time been dedicated to me is because the reality is that bias must be a priority. There are millions and millions of people probably 100 million in the US and billions around the world that live with obesity. And so therefore they're likely affected by stigma and prejudice. That means we have to address it. It really does harm people. It creates these systems inequalities that I've mentioned already. It actually hurts people's physical health because it makes you less likely to engage in activities that could improve your health. And as I mentioned before, and I'll say it over and over again, it is what keeps the policy changes we need to make as a nation and as a world from happening. People just think that people should just be able to do this on their own and not recognize that this really is a system problem. And I will tell you right now, there are parts of bias that are getting better. Um, if you are less likely today to be made fun of walking down the street because of your body weight. It still happens. There are still people who get their pictures taken at gyms and we make fun of them because they live in a larger body. You're still likely to hear a fat joke on television, but it is less likely than it was, say, 10 years ago. But the things people think, those implicit attitudes, when we actually study those through a group that uses Harvard's implicit association test, we actually don't see dramatic improvement there around implicit attitudes around body size. Interestingly, we see dramatic improvements around almost every other category: race, gender, ethnicity, sexual orientation, religious beliefs, etc. We do not see it around body size. So people may be saying less public things about body size and making fun of people publicly, but they're still thinking them, and that's a challenge. And I will say it's important to recognize that I have a lot of privilege being a man talking about this because I am less likely to face stigma and bias because I'm a man. Women are significantly more likely to face discrimination based on their body size. And in fact, it's the second most likely form of discrimination. That's a weird statistics to compare, what kind of discrimination you face. The most common form of discrimination a woman would face was actually being a woman in the first place. But this creates obviously this double standard for women affected by obesity. And I don't know if I didn't include the slide today, but I think and when I show the data around this, women's actually start being affected by stigma and outright discrimination at very low body weights. Even just in the overweight category, carrying 15 or 20 extra pounds, they are more likely to face discrimination. And by the way, by the time they get to being 100 pounds or more overweight, having severe obesity, it's often nearly half of them are facing outright discrimination because of their body size. Men don't face that same discrimination until we get that severe obesity point, and then it's only a quarter of men are facing that. So literally half the number of women are facing it. It's okay, and especially in the U.S. culture, for a man to be in a larger body, much more okay than a woman to be in a larger body. And obviously, I talked about this with the types of discrimination. It's worth recognizing that obesity bias does not occur in isolation. If you're of lower socioeconomic status and you have obesity, the combination of those is difficult to live with based on your race, your ethnicity, or your mental health condition. So I don't think it's not saying that weight bias doesn't replace these other inequities. It often amplifies them, right? So you have this double burden of these inequities. So we talk about this and we know how much harm it does, and I'll show you more data about harm later on, but why does it keep taking place? And I will tell you, we're going to touch on a couple of these, is that it's basically reinforced all the time that it's okay. It's okay to blame and shame the person living with obesity. Although I'll try to show you some positive things too, as we're seeing improvements in certain places. So you can think about how the media portrays people with obesity, right? You have these stereotypical portrayals. You see some of the examples that I put here. Both Eddie Murphy and Martin Lawrence have made a fortune, playing people with larger bodies. And honestly, these media depictions often normalize weight-based discrimination and mockery. It's okay to make fun of the fat kid. It's okay to make fun of the person with a larger body. And of course, if you see those things, this is why public perception is influenced, right? They say, okay, well, I heard that joke on TV, I can repeat it the next day, or I saw that show making fun of that larger person with a larger body, I can do that myself, kind of thing. And so probably no surprise that we see this reinforcement of blame and shame, this reinforcement of bias and stigma. And we actually study this quite extensively. There's been some amazing research that actually looks at how people with obesity are actually portrayed in TVs and films. And it's almost always negative. Although, again, I'm going to show you some positive examples in a second. There are very few characters with obesity that appear on television or in major films. They're almost always shown in these kind of harmful stereotypes. And there's a group called the Media Empathy Foundation did a beautiful report where you see these common and negative tropes. They actually tracked people. Like, this is the way people, all these bullets are the way people are normally portrayed by TV and film, as the deviant or the victim of mockery, the unworthy partner, body and redemption, body as a spectacle. And curiously, Rebecca Poole and her colleagues have done some work where they've actually said, well, has TV gotten better? Has it gotten better over time? And although I'm going to show you some positive scenarios in a second, there actually, it has not, right? I mean, the recent analysis shows that portrayals of characters with obesity as evil, cruel, unattractive, unfriendly, engaging, and unhealthy behaviors are increasing. They're not going down. So we have more work to do. But with that being said, let's talk about a little bit of progress, right? There is stuff that's happening every day. And in fact, this week, I got to talk about the show The Pit on television. We're actually featured a character who lived with very severe obesity, and actually the show tackled some of the bias issues, including having the main character tackle warning one of the trainees about the language that they used around folks around this specific character with obesity. And so I see some hope and some optimism here. The show This Is Us, that's on this slide, is a show that's now off the air, but featuring Chrissy Metz's character. But it actually was one of the shows that had the most realistic portrayal of living with severe obesity that we've seen on television before. And then maybe much more controversially, is the movie The Whale, which I actually got to work on. A group of us from OEC got to advise Brendan Fraser, who won the Academy Award for this show or for this movie, in his role in this movie. And again, the movie is mostly controversial, not because of the storyline, but because of the fact that Mr. Fraser had to wear prosthetics, or what some people call an empathy suit, what other people call a fat suit, to portray this gentleman who was between 450 and 500 pounds in that movie. But he became an unbelievable, compassionate, empathetic champion for addressing bias and stigma. And in fact, he does it to this day. We just saw an interview with him the other day where he actually talked about bias and stigma around body weight. And so very proud of his work. And but if you haven't seen that movie, by the way, it's a super tough movie. I've had to see it a couple of times, and obviously got to see a first cut of it. And it's a challenging movie to watch, but and not so much about his body size, although parts of it focus on that, but more of his relationship with his daughter. I also would say the media portrays people with obesity in challenging ways as well. And the reality is, if we look here at these images that you see on the slide, these are some of the most kind of common categories of images we see with people with obesity, focused on a body part, eating poor quality foods, being sedentary, being sad. And by the way, my pet peeve, always headless, like we cut people's heads off most of the time, right? Kind of thing. Um, and the reality is this is how the media typically portrays people with obesity. So if we took a story today about obesity and we looked at it, this is kind of the images you would typically see. Here's an example of that. This is an old ABC News story, but scientists discover a gene that controls obesity. Well, first of all, there's not a single gene. There are hundreds of genes that control obesity. There are people that have single gene mutations, though, that actually can contribute quite significantly to obesity. And so especially in some young children with very severe obesity, we do gene testing. That's an aside there. But look at that image, right? This is scientists discover a gene that controls, you name anything else, that is going to be a DNA helix, right? But in obesity, we show this belly, right? Kind of thing. We show someone squeezing the body fat. And that's just the typical way that obesity is portrayed. And again, I think it's unintentional, but it's a way that the media is reinforcing these negative attitudes. And we actually study this. This is a great study where Dr. Poole and her colleagues did, that actually looked at online news articles and the images or videos that were associated with them. And you can see some trends. Look at these negative trends that you see here on the slide. Headless, nearly 60% of the time. Focused on that side or rear angle, on the abdomen or lower belly, eating unhealthy food. Those things I talked about when I show you those slides before. But look at the challenge. We saw positive characteristics as well. People with normal weight were shown in professional clothing nearly 50% of the time. But if you had overweight or obesity, you were only shown that way 11% of the time. So this is, again, subtle ways that the media is reinforcing bias. I mean, so it is reflecting what society believes, but it's also teaching it, right? And those lessons really do hurt people, and they hurt people every single day. And then, of course, we can talk about the workplace, which is another challenging area for people with obesity. Many of you have likely seen one of the news specials where they take a person who is of normal weight and they send them in for a job interview. Then they take that same person, put them in, again, whether you call it prosthetics, a fat suit, an empathy suit, they send them in. And of course, the thin person is always hired. Probably seen that on TV. All the investigative news shows have done it at some point. The reality is, the evidence shows that it's very, very clear. We see this in inequitable hiring practices, more employer prejudice. We see lower wages, especially for women. We'll talk about that in a minute. And we see more disciplinary action and more wrongful job termination. There's assumptions that you're not a good leader. You have less lower success, expectations, and your qualifications are put into doubt, kind of thing, because you live in a larger body. And I think the most interesting thing for me, and again, we talked about earlier how women are more affected by this than men are, is this data you see here around wage penalties. So it's very consistent in the data. And you can see, and this one actually has the worst rate for women, but somewhere women face, if a woman has obesity, they earn on average somewhere between 7 and 15% less than our normal weight counterparts. And we almost never see that same discrepancy with men. So it's okay for a man to be in a larger body, but not for a woman. And this is interesting for me as I talk to employers, because one of our other challenges that I work on right now is that in this country, we have these new therapies to treat obesity, these GLP-1 therapies and surgical therapies and things along those lines. And many employers do not cover them, insurance benefits, although we're working at that and we're making improvement around that. But I often argue to them, well, look, you're already paying especially your female employees 15% less. And then you expect them to be able to afford out of pocket these relatively expensive therapies to do that. It's a double whammy, right? You get caught in a situation where it's almost impossible to work your way out of that cycle, right? And get the care that you need. And so just an interesting observation that, people are really penalized two ways, right? Because they're forced to pay for their own medical care because it's not typically covered by your insurance, and they're getting a wage penalty. And of course, bias really impacts healthcare as well. And I'm going to pick on some groups right now, and I just acknowledge that there are good healthcare providers out there. Not all of them are stigmatizing. But no, when we look at the data around stigma, healthcare professionals usually engage in stigma at a rate equal to, if not higher than, the general public. And a lot of that has to do with the fact that they don't get very much training around obesity in their medical programs. And really worth acknowledging that it's not just about the healthcare professionals themselves. It's also about institutional bias when you go into healthcare settings. Do they have the right kind of equipment? Do they have the right bed size? Do they have the right seating? Do they have the right gowns? Do they have exam tables and imaging? And do they have policies that restrict care based on weight? My dad has lived in a wheelchair for almost 6 years right now because he cannot get his knee replaced because his BMI is above 40, right? And that's not, to me, that's an institutional bias in healthcare. And like that, they've taken that shared decision-making process between him and his surgeon out of his hand because the institution will not do the procedure because of his BMI without actually doing an individual evaluation. And I really will tell you that I think I do believe most people are engaging in bias unintentionally. But I think a lot of clinicians, especially, engage in bias, thinking that they're going to help people when the reality is they're actually hurting them, especially with kind of the tough love approach that you see many clinicians take around body size. I think that does more harm than it does good. I didn't show this in the media slide, or it was sort of implied in it right there. But if you actually showed how the media thinks about obesity, you see all these words on this slide right now. That's just how healthcare professionals think about obesity as well. And you're like, well, why is that? Well, that's because a healthcare professional, unless they've come out of medical or their professional training in the last few years, likely hasn't gotten a lot of training around obesity. And so a lot of where they get their attitudes from is actually what they see in the media that we talked about earlier. So this idea that people are lazy or weak-willed or unintelligent or dishonest. And these stereotypes really don't have any basis in evidence at all. They just reflect bias. But I will say that I see some progress, especially in the healthcare environment as of late. a lot of that is driven by the fact that we have new medications that suddenly have gotten healthcare professionals to think about, well, wait a second, maybe this is a biological disease. Maybe there is something else going on here. Because why would this medicine work if it was just about people being lazy or weak-willed, right? Kind of thing. And so we see some change, and I have some optimism in this space. I think one of the most important things is to recognize how people react to bias. And I know this firsthand because I've experienced it. But you ultimately feel disrespected. You get upset by those comments. You think like you're not going to be taken seriously, and many of us just shut down. And then we also hear from folks that their weight is blamed for every one of their health problems. I have a good friend. His name is Ted Kyle. He writes a blog every morning at Conscious Health about obesity. But Ted often will say, I can go to my doctor with an axe sticking out of my forehead. My doctor will say, my head hurts because I'm fat, right? And the reality is that while obesity causes a lot of health complications, it doesn't cause every health complication. And we have to be cautious, and we have to urge our healthcare professionals to be cautious around this argument. One thing I will tell you in my own experience, I've always had hypertension. I've always lived with obesity. And my doctors always blame my hypertension on my obesity. Yet I now live in a reduced size body and I still have hypertension. They sort of, the reality is they were not linked together, right? I had primary hypertension. It was not related to my body size. And honestly, if they had just done a little history lesson with my family and cared to look through the details a little bit more, they would know it's very typical in my family to do that. So why take that blame, or why make me feel extra shame about my body size, saying it's affecting my hypertension as well? And of course, all of this makes those of us with obesity reluctant to engage, because we don't want to be stigmatized anymore. And by the way, if you're a parent of a child who lives with obesity, you feel especially blamed and shamed. And because the reality is that getting treatment for childhood obesity is even harder than getting treatment for adult obesity. Um, and the options are limited, right? And so special needs, and that's probably a whole nother presentation about how children are treated because of their body size. I mentioned this earlier about internalized weight bias, and I think it's important to recognize it again here, is that a lot of times when we turn that stigma internally, we traumatize ourselves, right, kind of thing. And oftentimes when we're talking to clinicians, we actually encourage them to actually treat obesity in a trauma-informed way, recognizing that most people have some of this internalized bias. And ultimately, we know people with internalized bias avoid healthcare, they have more disordered eating behaviors, they have more depression and anxiety, and they have worse health outcomes. And, I will just say that people with obesity, again, because of that internalized bias, because of that trauma that they have, are hypervigilant in a healthcare setting. We are more likely to see bias everywhere. By the way, people who know me say, well, Joe, you see bias everywhere anyway, because it's part of my job. But the reality is most people who live with obesity are hypervigilant, especially in the healthcare setting, about their body size. And we really do need to recognize that past experiences of stigma really affect people's present behavior. And we must be acknowledged when we deliver care for obesity. And Robin Pashby has written beautifully and done a few presentations on this topic of trauma-informed obesity care, if you ever want to pursue more content around that. And of course, bias really does impact quality of care. A lot of people say, Joe, well, you're just too touchy-feely, and like, does this really harm people in some real way? And I will say it absolutely does, because the data you see on the slide. In fact, on average, a person with obesity spends less time in their healthcare visits than someone without. How is that possible with all the complications associated with obesity? But they do it because of bias, right? I don't want to talk about it. My healthcare professional doesn't want to talk about it. Doesn't get talked about. The scheduler loves me because I'm in and out of my visits quickly, but that's not good for my long-term health, and we face consequences for that moving forward. We also see very clearly that people delay their care because of their body size. And I will just tell you that this is something I've done many times in my own life. As I've said, I've struggled with obesity for 34 years, currently well treated, but that has not always been the case. And I still remember these times where I've said, well, I'll do my annual checkup when I lose another 20 pounds. And suddenly 2 years goes by, 3 years go by, 4 years go by, 5 years go by, right, kind of thing. And luckily, I didn't face any consequences because of that, but many other people have. And we see it very clearly in the data that people with obesity are less likely to get their cancer screenings, their routine vaccinations, their preventative health services, and they're more likely to delay or cancel appointments or skip these recommended follow-up visits. Excuse me. The number of letters, unfortunately, that I receive at OEC, oftentimes with a charitable contribution and in memory of someone, of people who have delayed or people who died because they did not do follow-up care and or did not do preventative screenings, is truly heartbreaking. We've got to overcome shame and blame because it is costing people their lives, right, kind of thing. And it's probably one of the hardest parts of this blame and shame situation. One of the things we actually see when we look at the data of people who become treated for their obesity is suddenly they spend a whole bunch more money in the short term on healthcare. And it's actually not because it's not because of the cost of the obesity care, although obesity care can be expensive. It's actually the cost of getting caught up on all these other things that they've missed for years, that insurance companies haven't had to pay for years. Now saying people are more expensive because they're losing weight. But the reality is they're more expensive because they're actually getting the services done that they should have gotten done for the past several years. And of course, bias impacts people's health and well-being, whether it's social, psychological, or medical. And I will just say I can include this in here just because I think it's important. It just actually came out of something with that the American Diabetes Association did. They did a standard of care for obesity care, and it actually just talks about the overall impact that stigma has on people's on health and the physical reaction that they have for our scientists and clinicians and that may be listening tonight. But I think the one thing that I think people misunderstand about bias and stigma is they assume people eat less if they get made fun of because of their body size. And the reality is it's very clear that people eat more because of that. So if you're making fun of someone because of their body size, you are actually making their obesity worse, not better. I've given thousands of talks now over my 20 years of doing this work and talked to hundreds of thousands of people. I can count on my hands and my toes the number of people who told me that they addressed their obesity because someone gave them a hard time about it. I can tell you thousands of people I've talked to who have told me that it was because someone showed them a compassion, empathy, that they were able to do something about their obesity. Of course, there are all these consequences. We've touched on most of these already. I will just say on this slide, include some of the ones for kids. And just on a side comment here from me today is, bullying of children, childhood bullying is a major problem in this country. Almost all of you who have school-age children probably have had bullying materials come home. I would challenge you to take a look at them. Unless you live in a handful of states, they likely do not include any information about weight-based bullying. It is so ingrained in our culture that it's okay to make fun of the fat kid at school that it doesn't even make the bullying materials. And the bullying, I can tell you right now that more children have harmed themselves because of weight-based bullying than of all the other forms of bullying combined. And that's right. All bullying is wrong, right? But just to show that somehow, again, in making obesity bad, we made the people with obesity bad, and it's unfortunately reflected in kind of these policies around our children, which is truly heartbreaking. This is actually the slide that I mentioned earlier about when we talk about eating. So basically, bias makes people eat more, not eat less, or engage in unhealthy eating behaviors. About 80% of people turn to food when they are stigmatized because of their body weight. And that really is making obesity worse. And here's that data again shown a different way. Especially if you're trying to address your obesity, right? And you're in some kind of obesity care program, but you're getting made fun of or you're getting stigmatized at home or at work or in the healthcare environment. You're taking in more calories, even when you're on these new remarkable medicines that reduce body counts, right? Kind of thing. I think stigma can overcome them, right? And of course, if you're taking in more calories, you're losing less weight. And there's all these other health consequences that we don't talk about. People aren't doing their activity, they're more likely to drop out. And of course, we have this reduced quality of life associated as well. So I would challenge all of you right now to think about what you think about people with obesity. What assumptions do you have about a person in a larger body with obesity? If someone walked by your window right now and say they weighed 400 pounds, what would you think about them? And I would challenge you not to make any judgment about their health. Because if you don't know that person and you're not their healthcare professional, you don't know anything about their health, right? They could have done something remarkable, which is lose 100 pounds because they weighed 500 pounds a year earlier. That they don't look like a men's health or a women's health cover model right now, but they are healthier where they are, right? Kind of thing. Actually, treating obesity is not about looking a certain way, it's about being as healthy as possible. And I also encourage you to try to be as sensitive as you can to the needs and struggles of people with obesity. When you're in the doctor's office now, a lot of doctor's offices have a little wider seating for people with obesity, but everyone likes to sit in those seats because they feel a little more comfortable. But if you don't need one, and then someone in the room needs one, make sure you move to make them more comfortable, right? Let's reward the healthcare professionals for making that change, but let's not take advantage of those larger seats if we don't really need them. The one thing I talk about, I really don't think we're going to solve blame and shame by blaming and shaming people who blame and shame. So, how do we solve blame and shame? We actually talk to them about the complexity of obesity, and people are less likely to engage in bias and stigma if they understand obesity is complex. They understand obesity is a disease. I often talk about my own lived experience, right? I talk about all the things I've tried in my life and that all the successes I've had in my life, that this was the one area that I needed medical intervention for, right? Kind of thing. And to try to get them to understand that this is not about because I was lazy or I didn't try hard enough. And remember, addressing obesity is hard. And by the way, we do not have solutions for everyone yet, even with these new amazing medicines that we have right now. We don't have solutions that work for everybody yet, nor does everyone have access to these medicines. I would encourage you to think about your language, you know, focus on health more than weight. I actually really would encourage you not to make a comment about someone's body weight unless they invite you into such a conversation. Someone walked up to me not long ago and I think very well intentioned me, Joe, you've lost a whole bunch of weight. You look great. How much have you lost? And I will say, I mean, I didn't do this, but I was tempted in that moment to say, you know, first of all, you shouldn't comment on my body weight because how do you know I'm not dying from cancer and I've lost this weight unintentional weight loss is a really bad thing, right? Just like intentional weight loss can be a good thing if it's done for the right reason. So I don't think we should talk about people's body weight. And then let's watch the language too. And I mean, even words, and you've heard me use them during this presentation because I have the tendency to, as shock value, to use the word fat, but fat usually offends many people, although there's a small population, part of the population that's part of the fat activism movement that actually likes that word. But the one word I really would encourage you not to use is the word obese. We would never say someone's heart diseased or cancered, right? So no, people have obesity, right? Kind of thing. And I would encourage you to strike that word obese out of your vocabulary. Here's the slide about that very specifically. You can say a person has obesity, a person lives with obesity. And by the way, you have to practice that. It took me 2 years to work that word out of my vocabulary, except using it intentionally like I have today. Um, and I think there's a lot of subtle ways we use words around obesity that are different than other diseases. So, for example, people often say, "Well, I failed Weight Watchers, or I failed a GLP-1, or I failed surgery." You would never say that, for example, in cancer care. You never say, I failed chemotherapy. You would say, chemotherapy failed me, right? And we have to think about that. We use that language. So, look, so that, a GLP-1 didn't work for me. I didn't fail it, right? It's the GLP-1's fault that it didn't work, right? Not my fault that it didn't work. It just wasn't the right medicine for me. And by the way, there are other medicines that you can try to move forward and other treatments you can try to move forward. By the way, I mentioned bad imagery earlier. There's great imagery that you can use if you ever need it. Visit OEC. We have an image gallery for you to be able to find imagery that looks good and doesn't stigmatize people. And here's my kind of, as we wrap up here, a couple of things from my end. Please no headless imagery. People with obesity have heads. I know people saying you're protecting people's privacy. I don't think you are. You're just dehumanizing people when you do it that way. Please don't make any character assumption about someone because of their body weight. People have tried over and over to address these issues. It's not because of laziness or lack of willpower or a lack of personal responsibility. And please eliminate that word obese. If you never used it, don't ever start. And please don't use that word anymore. It's actually it's one of the major contributors to bias and stigma, in my opinion. And I would ask all of you to, as we think today, is to self-reflect, stand up, speak up, and take action, right? There are things that you can do. If you see bias, say something. Again, I would approach it from, we're not going to solve blame and shame by blaming and shaming, but I would also, be not afraid to stand up and say, hey, maybe there's a different way you could have talked about that, or maybe that wasn't okay that you told that joke or whatever it may have been. I will say that I know I believe very strongly that we're going to have to change bias by changing one heart and one mind at a time, but know that that's not going to be enough, that we're going to have to do things in clinical environments and through policy change and through professional training to do this, right? Kind of thing. It's going to have to go beyond that, just like we've had to do that in other areas of inequities. And so here's my summary. Bias is really a pervasive problem, really does hurt people. It makes obesity worse. And I can't tell you that enough. Like, we are making obesity worse by stigmatizing people because of their body weight. We are not making it better. And it really allows the system to continue to ignore those of us who live with this condition, and who need true and good quality care. The reality is that it's not about just being kind. It's about being effective. And honestly, we can't, we're not going to address obesity by simultaneously stigmatizing people affected by it. Compassionate and evidence-based medicine go hand in hand. And that's, one of my major goals is to make sure the system provides that moving forward. So I want to thank you for your time today. I would encourage all of you to join us in our efforts to stop weight bias. And I'm going to welcome back Karen, and we'll take a couple questions if there are any. Thank you.
Thank you so much, Joe. I mean, gosh, I learned a lot. I am sort of doing a lot of soul searching, and you brought a lot of just incredible points to the surface. And I even consider myself to be fairly savvy, I guess, in these sort of situations. Obviously, I work with the cardiac community, but gosh, it's incredible that the examples you brought to this. So I know a lot of us are going to take your suggestions to heart. Can you tell us a little bit more about your organization, the Obesity Action Coalition? What do you guys do exactly? How does it work? Where are you based? All the things.
Yeah, so OEC is now the 21-year-old. We're about to celebrate our 21st birthday. We had our 20th anniversary last year. Organization made up of people living with obesity. We're actually created after an elected official stood up at a meeting and said, I'm asked every day to do something about the obesity epidemic, but it's always by a public health official or by a doctor. I've actually never heard from someone with obesity um, come into my office and ask for help. And he actually went further that day. This was 21 years ago, so it was the heyday of bariatric surgery. And he said, I could pass a law in my state today making bariatric surgery illegal, and not a single person who needed it would march on my front steps. He kept saying, where are the people who live with this condition? And so OEC was created to do just that. I got to be there at the beginning and help create that. And we do exactly that. We make sure the voices of people with obesity are included in all of these kind of policy conversations moving forward. And that's, the advocacy side of our organization. But I think the other part that is equally as important is the education and support side of that. So our organization is made up of almost 100,000 people who have raised their hand like me and said, I live with obesity. And we support each other in that journey, and we produce education, that's based on science-based material. So, OEC is 100% agnostic on how people address their obesity as long as it's evidence-based, right, kind of thing. And look, there's a lot of gimmicks and a lot of malarkey and snake oil out there, right, kind of thing. We push back against those kind of things, but we also advocate for people and their healthcare professional to have it go through a shared decision-making process and pick the evidence-based method that works best for them. OEC is based in Tampa, Florida, although we're a national organization. We're relatively small. We have a dozen employees and located all across the country, but 8 of us based in Tampa. And again, most known for our policy work in the national level and at the state capitol. And if people want to learn more about OEC, you can go to obesityaction.org. So.
Thank you. We have a question around compounding drugs.
Yeah.
And I believe people feel that the message sort of that's coming at the consumer can end up being fairly confusing. Can
Yeah.
you touch on that a little bit and kind of
Yeah,
give
let's talk.
insight?
I like that. Let's talk about messaging towards the consumer, then I'll work compounding into it. So, it is interesting. One of the things that worries me in the current environment is that obesity care, because the system is not set up to provide high quality obesity care, and insurance typically doesn't cover it, it's become a consumer driven market, right, kind of thing. And this is a major health issue, but like cancer and diabetes and heart disease, right? But somehow consumers are expected to figure it out on its own, right? Kind of thing. It's become this very consumer driven. It's always been that way, right? I mean, you have companies that have made billions over the years, whether it was the diet programs or the commercial weight loss programs or whatever it may be. They've done that over years. And then lately, obviously, with the dawn of these new GLP-1 medicines, that at first were very, very expensive. Some people stepped into the market, especially when there was a shortage, to fill a gap. And that gap was creating these compounded medicines. Like, look, I do not blame anyone who uses a compounded medicine to treat their obesity if they chose to do it solely for cost reasons. They evaluated every single other option, and that was the only option that was available to them. But I will tell you right now, I think we have to go back. You have to go back and relook at it right now if you're using a compounded medicine right now. The prices have changed. Medicine's getting less expensive, more affordable. And it's time to go back and have that conversation about can we shift to a branded medicine? Because compounded medicines are not FDA approved. They don't have the same kind of oversight. And in fact, in just last week, and I think made public actually this week, the FDA sent lots of warning letters to compounders and the telemedicine platforms that have been promoting them. And so they make me quite nervous. Although with that being said, I know plenty of people have had great success in compounds, but it is time, I think, to have that conversation with your doctor about switching to, or your other healthcare professional, switching to a branded medicine. So I also would worth noting that and one question I get asked all the time, and I'll just throw it out here, is do I think GLP-1s are helping or hurting when it comes to weight bias and stigma? And I will say, I think I said this during the talk, for healthcare professionals, I think it's actually helping, right? Because it's actually giving them tools to use, and they're less likely to engage in this. And instead of wagging their finger at you and saying, don't come back until you lose weight, they actually have an option for you now. But I'm not 100% convinced yet in the public if that is the case, right? And again, many of us who seek treatment and we're public about it kind of get belittled a little bit because we're perceived as taking the easy way out, right? Kind of thing. And we should have just worked harder. And so I think in some ways that'll raise stigma. And then I worry in the long run, we have these medicines probably work, and if you can tolerate them, about half of people. But again, it doesn't turn everyone into a men's health or women's health cover model, right? Many people still live in larger bodies. And I do worry that there's going to be this societal expectation that we all look like a men's health or women's health cover model eventually. And I think that's not, we've got to fight against that, because the reality is well-treated obesity still looks like people in many different sized bodies. So.
I'm curious, we were chatting before we actually opened up the webinar tonight, and I know you have some upcoming presentations that you're giving in Germany. You mentioned that.
Yeah.
I'm just curious, sort of, how does all of this sort of live in other countries also?
Yeah.
Is the US unique in terms of all of this, or I'm just curious
Yeah. So
internationally what you're
yeah,
finding.
it's a great question, and I get asked it more often than not. And actually, have a researcher who I know and who is in Europe now, who actually had one of her graduate students actually do the analysis of, let's look at bias and stigma all around the world, and collected the studies from all around the world. Because I would sometimes be in certain international settings, and someone would claim to me, we don't have any bias and stigma in our country. We have in our culture, we have a preference towards women with larger bodies or whatever it may be. But actually, when they collected the data, they saw bias and stigma in all those places. Maybe it manifests slightly differently, but the reality is these issues we have in the healthcare environment, the issues you have at work, the issues you have, with relationships, all those other things, it was still very, very similar. So it might look slightly different, but it
Mhm.
still exists, and it's an interesting challenge. I will also say, one of the things I sometimes worry when I give this presentation is that I'm saying that thin people are stigmatizing people with larger bodies. But I want to be very clear that people with larger bodies also stigmatize other people with larger bodies as well, right? Kind of thing. This is not a problem of, where you are with your body size. I've been in situations before where the example I remember was on an airplane where the gentleman was just complaining vociferously about the person next to him. And eventually the flight attendant told him to knock it off. And eventually I stood up and turned around and in my very Southern way said, the good Lord creates us in all shapes and sizes. If it's so much of an issue, you can have my seat, right? Kind of thing. And when I looked at him, not this was all behind me until that point, when I looked at him, he was larger than she was, right? Kind of thing. And so it became an interesting, remember, this is not just about thin people making fun of or giving people with larger bodies a hard time. This is also other people in larger bodies doing it to each other as well. So Yeah.
So I have to know, did the guy switch seats with you or
He
did
did
you?
not. He sat down and didn't say another word the rest of the flight.
Oh my
Although I,
gosh.
yeah. So
Yeah.
of course
Good.
it was uncomfortable for everyone at that point. And
Sure.
by the way, that's why I always talk about story about that was the only because the flight attendant came running up the aisle when she saw me turn around and talk to him. And so I
Thinking it
thought
was
I was gonna
escalating.
I
Yeah.
think I was gonna, was gonna get something uncomfortable. And she bought me or tried to buy me a drink. I don't drink on airplanes, but she bought me a drink later
Yeah.
on afterwards. So
Oh my goodness. Wow. Let me just see. I think okay, we do have a question. Somebody is asking about how many people use your agency annually.
oh, so OAC, yeah. So I mean, we have 100,000 members, but there are hundreds of thousands and more who tap into our educational resources. Actually, think our website gets 50,000 visits a week, right, kind of thing. So it's quite. Obviously in the world that we're living in right now, where this topic is talked about every single day,
Hmm.
there's a lot of resources. But again, I will admit that it's a brave thing to raise your hand and say, I have obesity, I'm going to join the obesity organization, right, kind of thing, especially because of all the stigma and bias we talked about. So we probably should have a lot more members than that, but I'm pretty happy with the number we have right now. So yeah.
That's amazing. I mean, all the lives you're touching and
Yep.
yeah, it's just amazing. Any other questions? Feel free to put them in the Q&A. We're getting a lot of really great feedback in the chat. People are thrilled with the time that you've taken to be with us tonight. Excellent presentation. And of course, folks are looking forward to watching it again as we get it on our YouTube channel. But I think that's everything. And again, you have given me a lot of things to think about, and so I'm super grateful for that. Just
Yeah.
opening my eyes and just kind of learning how to see things from a different perspective. I think, those are skills we all need right now. So thank you so much for your time, and thank you to everyone that joined us tonight, and have a nice evening.
Thanks, everybody. Thank you very much.
Good night.